All right. Welcome, everybody, and thanks for joining us on another episode of The BAM with Lori and Ginny. Today, we have a very special guest, Renee Good. She is going to take us on her journey of being a nurse and now owning her own practice in the Denver area. And we're looking forward to learning all about the journey that has led her to her current path. Renee, welcome to the show.
Thank you so much for having me.
Yay, we're so excited to have you. And we always open up this big question, take us back to where it all started. But it's a pretty overwhelming question. But with being in the health and wellness industry now and kind of having a background in the health and wellness, I mean, let's go way far back to how that kind of sparked your interest, how you got into that. And, being a mom, you have 4 adult children, which we love talking about. How that kind of molded your path along the way. I know you were also in real estate at a point in time, correct?
Correct.
Okay,
Yes.
cool. So let's touch on all those things. So why don't you kind of kick us off and take us back to first what sparked your interest in health and wellness and kind of your journey with real estate?
Yeah. So I think they're all so connected. I'm going to have to go way back to being a mom at 18. I had my first baby at 18. So I've got a 30-year-old, a 28, 26, and 24-year-old, 3 girls, 1 boy. So that's been a whole adventure all on its very own. But I was a stay-at-home mom for them for a long time, thanks to my wonderful husband. He saw to that. However, I did go and get my real estate license when I was pregnant with my son, so 24 years ago. And that was a great career until it wasn't. And it was not in 2008 when the market crashed. And my husband at the time he was a mortgage broker, and I was in real estate, and we were like, whoa, something's got to change here. So I went back to school, became a nurse. Caregiving was kind of a natural fit for me being a mom. It was kind of all I knew, being that I became a mom at 18. And so, yeah, I became a nurse, loved parts of it. I loved the patients who really wanted to help themselves. Some of my favorite nursing jobs were at Craig Hospital on the spinal cord injury floor.
Yeah.
Absolutely loved the patient population. Although it was sad and horrible what had happened to them, to be a part of their new normal and helping them find that new normal was amazing. So I loved that part of it. And then, surgical oncology, operating room nurse. And then I was an ER nurse. When COVID hit, I was in school to be an NP. And that kind of changed everything for me. I realized that I wanted to be more proactive in patients' lives and not so reactive. And so finished my nurse practitioner school, went into primary care, thought that maybe that was going to be it, and realized that still wasn't it. I loved parts of it, but we were still very much within the constraints of what insurance companies felt that we should do as providers. And so my daughter at this point in time, my third daughter, who's 25, had a baby. And so I'm a grandma, 1-year-old. He's the best thing ever. That's my most favorite role. And so I was fortunate enough to be able to take some time off and help them. He was a very challenging baby, to say the least, so much so that I would have taken all 4 of mine at once over just him at one time. He's been a real challenge. The best, but a challenge.
Yeah.
And so that gave me an opportunity to kind of look into things and say, what is it that I want? I always knew in the back of my mind I would open my own practice. I just didn't think it would be so quick.
Mm-hmm.
But life has different plans sometimes, and it just happened to work out. So 6 months ago, I opened Good Integrative Healthcare, where I just focus on hormone health for both men and women, medical weight loss, and then sexual function. And it's been a ride, but I'm loving it.
What made you focus on the hormone piece of it? Like what brought you to that specialty?
So I think being that I'm 49, I've kind of hit that point in my life where hormones play such a huge role in everything, not just what everybody thinks about with libido or being able to lose weight or have a healthy weight, but even just the mental aspect really is something that affects hormones so much. And so for me, it was kind of a personal journey. I've always liked the hormone aspect of things and how it's also interconnected in our bodies. So really just kind of focusing and honing on that. I was like, ooh, this is what I really like. Hormone replacement therapy has helped me a ton personally, and it's helped so many patients. So it's a really satisfying practice of medicine.
It's crazy. The hormone thing is like the real deal. So I am 43 and
Okay.
I am experiencing those pre-menopausal like things that when you're younger, you're like, I'm never going to go through that. That's just for the old ladies, And then when
Exactly.
you hit that age where it's like, you start to have really bad cramps, your emotions are just out of control, like maybe even worse than being pregnant. I feel like at times where I'm just like irritable, I'm anxious, all these things that you kind of think, oh, those are never going to happen to me, right? So it's just really, Jenny and I, and Jenny being a little bit older has, is or still going through some of this in some respects, but just having the resources to reach out to, and talk to and really guide you, as opposed to just going to a general physician and being told the black and white. I think you kind of focus on kind of more of that gray area of helping women. Am I correct? Or
Absolutely. Absolutely. I think so many times normal medicine just wants to throw a medication at it.
Yeah.
Oftentimes it's an SSRI because after all, women are crazy, right? When we go through these hormonal changes. And so that's kind of a real easy fix of, well, we'll just put you on an SSRI and maybe you're just a little depressed, maybe a little anxious, and this will help us get through it. And and I'm not saying that that is a wrong path, because maybe some do absolutely need that as well. But without balancing those hormones and really making sure that all of that is dialed in, we're just kind of putting a Band-Aid on it again, and not being proactive for women. And I think it's normalizing the conversation too, and letting women and men know that, hey, this is a normal part of maturing, and this is something that everyone goes through in some shape or form, and that we don't have to suffer with it. Like, for so long, my mother or my grandmother, or, they just suffered with it. It was just what women did. And so I think having the option to have some treatment and some support in it is so important.
It's interesting to sit down, and I was like, what the hell is happening? And I had no idea that it was like menopause, hormones, all of those things, but it affects absolutely every inch of your life, like your work, like the brain fog, the anxiety, the, depression, the inability to remember things, it's just crazy how much it impacts. And so I think it's absolutely important work. Did you have to go back and get something specific to handle, like to deal specifically with hormones, or did your general education cover
courses to educate myself? And I feel like it's just truly a lifelong learning. There's so many different perspectives on it. So really getting all of the perspectives, I think, are so important. There was a doctor I was listening to, and he said, being ignorant is okay. There's nothing wrong with it. But being arrogant and ignorant is where you really run into trouble. And so, it's okay to not know things, but I think admitting that and really researching it and asking the questions are so important, no matter what field we're in life. That lifelong education piece is huge.
Yeah,
no,
absolutely.
Absolutely. So I think let's go back a little bit more. So you were in real estate at one point. So I'm kind of wondering how that transitioned. I believe, was probably a good time for you to be in real estate with the kiddos, right? Am I guessing that provided a little bit of flexibility?
Yeah.
And based, with your experience on real estate and where you currently are, do you feel like there's been any overlap and lessons learned and like?
Yeah, I think the biggest connection would be dealing with people, no matter whether it was real estate or patients, or colleagues, it's a people business, really. And so I think those early lessons in life, whether it was being a mom and really realizing that it's not always my way or the highway, as much as I would love for it to be that way, that's just not reality. And so I think real estate really kind of helped with that too, because it was trying to, find compromises from the buyers and the sellers and bringing people together. And I think, in medicine, it's very much about partnering with my patients. And just because this is what I'm recommending does not mean that this is what my patient has to do. This is a conversation. It's a journey. I will tell you what I think, but ultimately it is my patient's life, and I'm there to support them. And so I think a lot of those lessons learned early in life have really kind of benefited my outlook and perspective as to where I am today.
I have to ask you, how was going through nursing school with 4 kids?
It was interesting. It was interesting, because they were so, my youngest was 8 at that point. So I had 8,
Yeah.
10, 12, and 14. So there was a lot of activity going on. They were all involved in sports. And so our evenings were kind of that divide and conquer. My husband would take a couple, I would take a couple, and we would go and, do the activities. There was a lot of mom guilt. I'm not going to lie. There was a lot of that. Am I putting myself above my children? Should I just wait? Should I hold off? And ultimately, I'm so glad I moved forward and did it, because I think you can balance things. I don't know that I love that word, because it's a really hard word to strike. But I think if you have support, which I had, Eric is amazing. I can't say enough about him, that, he truly picked up the slack. He would, pick up a side job if he needed to, so that I could cut back on my job. And it truly was teamwork. And without him, I never could have done it. So I don't want to sit here and just say that it was easy. I had a great support team, and that's huge.
I'm guessing Eric wasn't your mailman, but your husband.
Correct. Yeah. Eric is my husband.
I mean,
thanks for clarifying.
Or both. I don't know.
Right.
Could be.
Yes. Husband.
The mom guilt thing, though, I don't know that goes away no matter what you're doing. I think even if you hadn't gone back to school, would you have felt guilty that you were, not happy in your job, and they could tell, you know what I mean? It just follows you wherever you go.
I agree. I think it does, truly. And I think it works itself out. When they're raised and you hear the stories, you're like, oh, they're going to be on someone's couch eventually. Anyway, it doesn't matter what I did.
Yeah, I know. It's interesting to see how they have perceived different parts of their childhood. My daughter said something over the weekend. I was like, that obviously bothered her. And I had no idea. And it seemed like such a benign thing,
Exactly. Yes. I cannot tell you how many times we've had, all the kids together and their significant others and the stories. And my husband and I just look at each other and we're like, do you even remember? Like, so not our perception, but to them, it really was their perception.
Yeah.
So yeah, it's interesting. It gets better and better.
Yeah.
Have you had the opportunity, now that your kiddos are all grown, although our kids, I feel like, are never really grown, right? Like we always are going to be, just as we do reach out to our own parents. But what has their perspective been? Like, we talk about different perspectives of like looking back at their childhood. How do you think they look back when you were that working mom and going to school? I mean, do you think that affected them at all? Do they ever talk about it? Like, Mom, you weren't there, or they're just like, it's all good. Like,
I think more of the conversation is very positive. They really, truly appreciated the fact that we kind of pivoted and made changes in life. And, it wasn't at the exclusion of them or to their detriment. But in fact, the oldest two are nurses themselves.
Oh, really?
So they actually found the process very interesting, and, are nurses and love it. And then the younger two, the third one is a mom. So she's fortunate to be a stay-at-home mom. So we're able to connect on that path. And then the youngest one is in real estate. And so they've all kind of taken their own path, but they do really respect it looking back, because with the exception of the one who's a mom now, the other three don't have children. And they're like, it's hard to even, go to school or, become that nurse on their own without the responsibilities of 4 kids, dinners, home, family, just all of it. So I think it really kind of raised their respect level. And, we've always been a really open family. So the conversations were always, what do you need? Should I be doing something different? I did take a semester off here and there. I'm not going to lie and say I, put my nose to the grindstone and went straight through. When situations came up, we did take some time off and address what we needed to address. So
I also think it's important for our kids to see that we can change our mind and reinvent and go a different path anytime in life. And so, it's like, you can change your mind. You can love something and then decide you don't love it anymore, and you move on to something else, and that's okay. And I think so much like my childhood, my parents were always like, you got to stick with this. You got to stick with this. You got to stick with this. And I wasn't, with like sports and stuff like that. And I was one of those people that like to try a bunch of different things and just follow what made me happy, And so I would do it for a while. And then I was like, okay, I'm ready to move on to something else. And I don't know that society really celebrates that much. I think it's more like, well, you went to school for this. What's your major? Oh, well, you got to work in your major, and then you got to stick with this. You already invested time there. And there's a different way,
Exactly. And it's never too late. It's never too late to switch course and find something new that you're passionate about.
Yeah, I totally agree with that. I think being that example to your children is so empowering to them to really be able to say, okay, especially, Jenny has kiddos, in college and graduating and already graduating, it's okay to change your mind. Just because last year you thought you were going to be in this place and you're not, like, reassuring them that life is a journey and there's always twists and turns and kids that come up, or, it's just, I think that's the fun of it. Although at times it's stressful, right? Very stressful.
Right.
I think that, that's the best example we can be as moms, is that there is no wrong decision. There's learning opportunities.
Absolutely.
So, yeah. Well, so let's take us back to, I want to go back to your kiddos again. So are they all close? Were they close growing up? Are they close now? How does...
Yeah, so they are very close. Being 2 years apart, they, had a lot of the same interests, same hobbies. The girls, same clothes, same friend groups. So there was a lot of togetherness. Not going to lie, teenage years challenged that a bit. They fought like every other child out there, every sibling, but they are very close. And, probably don't get together as often as they would like. The oldest one lives in Montrose, small little town. And then the second daughter lives in Colorado Springs. And then third daughter's here in Littleton near us. And then our son just moved to Michigan with his girlfriend.
Oh my gosh.
They bought a home and, they're just, this will be his first winter there. So we'll see.
Yeah.
We'll see. He was kind of my boomerang. We would throw him out and he'd come back home. We'd throw him out, he'd come back. So it's been a little bit of a challenge for him, but we'll see if this sticks.
Yeah.
And if it doesn't, that's okay too.
Yeah. Yeah.
So
Well, go ahead,
I
Jen.
have to ask, as far as, and I'm bringing you back into the present moment, because I'm so curious, like if somebody, like if I were to come to you, to your practice today and say like, this is what I'm experiencing. Like I'm exhausted. I have brain fog. I'm, moody and I just can't get my shit together.
Anxious, tired, sweating all the time.
The list. My ears are itchy. I heard that as a sign of like hormones. I'm like, what the fuck is that all about? So anyway, let's say I have this like big old long laundry list. Like, what is your process? Like, how do you work with patients to figure out what the hell's going on?
Yeah. So really the first appointment is just a conversation. We're going to dive into, past medical history, family history, diet, exercise, relationships even. And then we will, based on, the conversation, I'll order a bunch of labs. We'll always get lab work because I can't see what the body's telling us. Only the body can tell us what it's telling us. And so, really going through those labs with the patient and then making a game plan from there. One of the big things that I've learned to appreciate is there's just because something is within a normal range does not mean it is optimal or even where, ideal. And so, focusing more in on those areas where, yes, it might be normal, but that's normal whether you're 20 or you're 90. What about for you at 40 or 50 or 60? Where is that optimal range and where would you feel best?
And so remind us, and I don't know if we said this live, your business, you've only been up and going and doing your own thing now for under a year, right?
Correct. So we're 6 months open now. Yes. And it's a very specialized clinic. And I did that purposely so that I can really just focus and hone in on the areas that I'm passionate about. And so hormone replacement, sexual function, and medical weight loss. And medical weight loss and hormone function really, actually, they all three tie in so closely together, especially for women, but men too. I have some men patients, not as many as I have women. I would love more men. I think it's a little harder to get our husbands to, go get their testosterone levels checked, or, or take the time out to kind of take care of themselves preemptively. A lot of times, they were the ones in the ER that would come in with a heart attack or stroke and be like, I have no medical problems. And I'm like, no. You just never went to the doctor, so you don't know that you had medical, problems. And so, getting men to kind of take care of themselves too, preemptively is really important to me and something I'm passionate about.
If you were to say like everyone should get these like 5 labs, what would you recommend? Or is there like a standard recommendation that you would have?
I think it's hard to narrow it down to just 5 because so many people are at risk for so many different things based on their family history. And so, I mean, there are hundreds and hundreds of labs that can be drawn. I think if we are just going to talk at baseline for somebody who never goes to a doctor because they're healthy and they're just not needing, the care of a physician or a provider, I think getting a CBC, a CMP, a complete thyroid panel that's not just your TSH, that involves your T3, T4, TPO antibodies, reverse T3, getting a really good thyroid panel, because that thyroid is that master hormone. And if that's not working well, nothing else is going to work well. So that's such a key. Getting your vitamin D level checked is huge. Here in Colorado, you would expect, with as many days of sunshine, that we would all be pretty good with vitamin D. I would say the majority of my patients are 30 and below, which is low and then approaching deficient. So, just those labs and just monitoring that on a yearly basis is really important. And then, of course, the hemoglobin A1C. So it's hard to narrow it down to 5, I guess.
Everything. You need to get every blood test taken and go through a full CAT scan, body scan. Like,
right?
Yes,
all of it. Personalized. I like that it's, you're going to have that conversation and then determine. One of the things, actually, I'd love your thoughts on this. I'm trying to get my husband. I want us to do one of those. I don't want to advertise the brand, but the full body scans that you can get. I think we should just do one for baseline. And now they're available. I think the clinic in Colorado is actually opening in this fall. So it should be open like any day. But I know you can go different places in the country and get the full body scan and just see what's going on.
Yeah, medicine is coming so far, and genetics and, all the things. There's just so many opportunities. I think people have to make sure that they're okay individually with what those results might tell them. It's not for everyone, right? Some people want to go through life and not know if they are predisposed to, say, Alzheimer's or, whatever. So I think as long as people really realize what they're getting into and they're okay with knowing the results, then I think go for it. I think knowledge is power. And you can make changes and decisions based on that knowledge. But again, it's not for everyone.
I told my friend that I wanted to do it, and she's like, why would you do that? So you just want to know, like, what if there's something in there? And I was like, well, you deal with that. But it's interesting because just the different perspectives. I think about it like you might be predisposed to something, but I look at it like you might have a gun, but are you going to put bullets in that gun? Right? Like, are you going to do the things that will make that present itself? Or, are you going to minimize your risk?
Right.
I don't know.
No, exactly. I would much rather know what I'm dealing with or what I'm kind of predisposed to, so that I can make the better food choices, the better lifestyle choices, the better decisions that are going to do everything that I can do to kind of make sure I don't head so fast into that course that's ahead of me. And maybe I'll end up there, but how many years can I avoid that?
Sure. Can you add a couple of years because you're a little bit more proactive?
Exactly.
Knowing that you have the opportunity to help yourself, further yourself in your life's journey, as opposed to, oh my gosh, I didn't know this, and now I'm dealing with the repercussions of it. So it's very interesting. So I'm going to kind of switch gears a little bit. I want to talk about, you have your own business, but it always intrigues me about entrepreneurs, right? So obviously you've kind of real estate. I always look at real estate agents as your entrepreneurs. You're out there, you're selling yourself. Then you worked in the medical industry, and now you are back to really being that entrepreneur again. What are you finding the challenges to be? Are you thriving and loving it? Are you at times like, oh my gosh, this is just, what am I doing? Like, how do you get
All of
through
the
those?
above.
Yeah, how do you get through those day to day? Like, oh my gosh, I'm not only my business, I'm running my business, I'm doing it all. Like, am I doing too much? Like, I just want to be a grandma. I don't want to work anymore. Like, do you have any of these thoughts?
Right? Yeah. So yes to all of the above. I think I love being a grandma, and if I could just do that all day, every day, I think, oh, I would do that. But then deep down, I know that wouldn't work for me either. I love working. I love helping people. And so there is that part where there's overwhelming days. I will say seeing patients and being able to make my own decisions is where I thrive. The business part of it is where it's a little bit more challenging. I really don't know that I have that perfect business mind. I think that's always been a challenge for me. I know even before I got into real estate, I was doing mortgage loans, and first-time home buyers were my soft spot, and they were like just on that borderline of being able to qualify. I'm like, I'll take away my commission. I'll lower the interest rate.
Right.
And my husband's like, whoa, you can't do that. Like, I know you want to get them a loan. And so, fast forward that, I'm like, okay, wait, you can't pay. Okay. And so at the end of the day, it is a business, but it's finding that balance where I can still help people make it affordable so that I feel good and I sleep well at night and I can still pay the bills. So that's kind of a new balance that I've, haven't had to look at in the medical world. That, it definitely weighs on your mind, but loving what you do definitely helps.
It is. It's so hard. And I think that, you hear people usually start a business because they're passionate about something, but they don't necessarily have that business mind, right?
Yes.
So figuring out who you can maybe partner with or what resources that you can bring in that will help you with that piece. But, and Lori and I've talked about this too, but I think I was telling my business partner the other day, one of the things you learn in having your own business is every single gremlin you've ever had is going to come and surface and tell you all the things like, you can't do this, or who do you think you are to do this, or you don't know what you're doing, or, like all of the things that have, manifested themselves throughout your whole life are going to just bubble up. And it's
so true.
You learn a shit ton about yourself.
Yes. A lot of the self-doubt, at night, the brain wants to do anything but sleep. Yeah. And that seems to be my best time to do all the what ifs, 2 a.m, I'm great. What if this, what if that, So they're quieting those voices. I think, again, Eric, husband.
Not mailman.
Not mailman.
Support. Right. Such a wonderful support. And, he's a great sounding board for things, and he's very level-headed and kind of can take out that emotional piece sometimes that I, just naturally have. And so having someone like that is huge, where we can just look. Yes.
Yeah, you need somebody to zoom you out,
Yes. Yeah. Exactly. Kind of take that 30,000 foot view instead of, being so close and so involved that you just can't see the forest through the trees.
Absolutely.
Trees through the forest. Dyslexic. Did I mention that?
One it is. Yeah.
Are you the only one at your practice then, or do you have?
Yeah. So I have a medical assistant, Kristen, who is amazing. And honestly, I really don't think I would be where I am without her. She is phenomenal. Patients love her. We love her. Like, she's so knowledgeable and brings so much to the table that, I honestly could not take credit without giving her credit.
Yeah.
So
it's important.
But it is just the two of us, which is awesome.
And a lot, right? It's a lot of work.
It is a lot of work. There's that piece too of, I never had to worry about payroll. It's one thing if you don't take a check, but that payroll piece that someone else is depending on you, that adds to 2 o'clock in the morning
for sure.
thoughts.
Absolutely.
So when you're not busy, when you're, not being a grandma, not being a mom, not, running your business, what do you like to do in your spare time to like have your own sanity and to kind of decompress and,
Yeah.
give yourself that needed time?
Yeah. So, again, being a mom since 18, 19, I never had the opportunity to figure out what it was I even liked in life, right? I could tell you what my kids like, but it was, if someone would have said, Renee, what are your hobbies? I'd have been like, laundry. I don't know. Right. So I actually just started probably about 3 months ago, tennis
Oh, good for
lessons.
you.
Love it. And then about a month ago, I started horseback riding lessons,
Oh
learning
my
English, loving both. So, I'm taking
Cool.
the time to, I book that like it's an appointment.
Yeah.
Nothing interferes. Unless I forget my appointment, which I have done with tennis lessons. And then I'm so bummed. But, just trying to get out there and meet, women, they tend to be kind of middle-aged women, and just kind of having fun and just learning something new. So
Yeah.
I'm absolutely loving tennis and English horseback riding lessons.
Good for you. Did you
Yeah.
ever do that as a kid?
So my mom had horses
Okay.
when I was growing up. And so I was exposed to horses. They
Yeah.
were Arabian. So they were more like you looked at them and said, ooh, they're beautiful, but they were a little psycho. So we
Okay.
didn't ride too often. So exposed, but never immersed in
Yeah.
it.
Yeah.
So
Yeah.
I love it.
We think that's so great because we've heard before from other moms kind of in our age range where it's like, coming into their own, where it's like trying new things is so fun, right? Because I feel like either you've been too busy with kiddos as they're growing up, or, just too busy in your own business that you haven't thought like, I want to go try, maybe you've thought it, but you haven't done it. And to actually take that action, I think is so great because, I think there's still like a bucket list of things that I want to
Oh
do
yeah.
that,
Yeah.
you kind of get stuck in the rut of like, okay, I'm going to the gym but I think we're at a point where it's more than that. It's the community. It's the, getting out of your comfort zone and just knowing we're
Totally.
never too old to try new things. And that shows our kids, even as adults, right? Like,
Well,
hey, mom's learning tennis. Like that's awesome.
exactly. Yep.
so my youngest, we dropped her off at college last weekend. And one of the things that we're telling I'm just going to say she's a freaking badass. So she's 18. She's always been quiet and kind of shy until you get to know her. And then she doesn't shut up. Right.
Right.
But she went out of state, did not know a soul, and is having to navigate everything and learn everything about school in a different state, learn this new state, meet people, all that kind of stuff. And so as I'm talking to her, I'm like telling her like, try this and try this. And meanwhile, and I told her, I go, I've never done this before. Like, so I'm just like, I am so amazed at what she's doing. But here I am telling her to try all these new things. And I'm like, I need to make sure I'm trying new things. And
Yep.
so last weekend I did Zumba, which I had
Yes.
tried once before. And I was so angry because I was like, I didn't get a workout because I was so confused by all the moves. But this last time I went and I just like let myself be a mess. And I actually really enjoyed it.
Good. Yeah.
Awesome.
So I'm
I
like,
give you credit. I've looked at it and been like, should I? I'm like, nope.
well, I'm terrible. And there were these two little old women right ahead of me. And I mean, when I say old, they were like significantly older.
Okay.
And my friend was like, well, are you better than like, are you going to be better than them? And I'm like, no, let me be clear. I am the worst one here. Like, I promise you.
Let
So
me
here
go
we
with you
go.
next time, Jenny. I'll make you look
Yeah.
really, really good.
Yeah, I was like,
And that's
I
okay though, to
promise
be
I
the
am
worst one. That's okay.
So,
You were
but yeah,
doing
I
it.
mean, like, and now I'm also going to share, I am convinced that I could still be in the Olympics. After watching the Olympics, I'm convinced because there's so many sports in there that I had no idea existed. And this year I heard more and more, and maybe it was because I was paying attention more and more about older people being in the Olympics.
Well, what are you going to shoot for in 4 years?
I don't
then?
know. I have to try a bunch of stuff and see what I could actually.
Well,
do.
pickleball's on tap.
Well,
I mean,
one of them, I'm actually, this is going to sound nuts, but I've always had this like in the back of my head. I've wanted to try fencing, and I even looked it up years ago, and there was nothing close to me, so I never tried it. So I was like, maybe I'll try fencing.
I love
Go
it.
for it. Go for
So-
it. Nothing ventured, nothing gained.
We should just
Yeah.
have a club of like trying weird shit.
Yes.
Yeah, totally. We would embarrass our children, but that's okay.
Oh, who cares? They've embarrassed us plenty.
Yeah.
Absolutely. So true.
My son is, one of my sons is 7, and he's at the point where like everything I'm doing right now is embarrassing him. Like I started singing the other day. He goes, "Mom, stop singing." And he like got genuinely upset at me. And I was like, "Moms can have fun too."
Right?
And he goes,
Exactly.
"Yeah, but you don't need to sing."
Oh,
like,
yeah.
Wow.
That won't go away
like,
for a while, by the way.
I
No,
know, like
I
what
think I
happened?
probably still embarrass my kids.
Yeah, I think
Oh.
forever, right? I mean, I just, I
Yeah.
don't know. I just loved when they were littler and they just didn't care, right? And then there's like this
I
tipping
know.
point that it's like, oh wait, my mom is embarrassing. You know, it's like,
You know what? I just had a thought. I think that, when they're little, they don't give a shit about anything and they'll just do whatever. They don't care about judgment. I feel like the second they start judging you must be the second they start judging themselves. And that actually makes me really sad to think that it's at 7.
It's
well,
so
You know what I
true.
mean?
Very
yeah,
true.
there's been the like, my son has never cared about like his hair, but now
Yeah.
he's like putting water on his hair. And he's like, actually, this is my younger son. My older son, my stepson still doesn't care about his hair or his clothes or anything. That's been a consistent thing. He does shower, but my my younger one is definitely more like picking out his clothes. And I'm like, well, this is going to be a different journey.
Yeah.
So different. They're all so different.
Oh my goodness.
Yes.
Now with 4, you had 4 different, they all come from the same family. You don't expect them to be so vastly different, but they are, right?
Yeah. Yeah. Personalities are just so different. So different.
Who was the
And then-
hardest? Was it gender specific or was it just like,
So probably the second daughter was the hardest.
Okay.
She's a lot like me.
okay, yeah.
And so we butted heads like crazy. She was very stubborn, she was just stubborn would
Yeah.
probably be the best way to describe her. But I think early on, like I was used to the 3 girls after having 3 in a row. If I told them no meant no, and
Yeah.
they wouldn't push it. Having Ian, the son, no was a challenge. Like if I
Yeah.
said no, he would look at me and do it. And I was like, what?
Double down.
Yeah, what part of no did we not understand? So I think parenting styles had to completely switch when a boy came along. And then he got easy
Yeah.
until high school. And the girls were super easy. We've always been very close. So communication was really easy. And so I felt like as long as they were talking to me and that's what I was used to, we were good. I knew what they were thinking for the most part. I mean, they only tell you what they want you to know, but
Sure.
for the most part, I felt pretty confident that I knew what was going on in their life. We were very active in their life, but the son was a little more scary. He was not as talkative. And again, probably difference boy versus 3 girls that I was so used to, but the 1-word answers were concerning. How are you? Good.
They're very
What did you do
common.
today?
They're
Nothing.
very common. My stepson's 16. I'm like, how's your day? Fine.
Right.
yeah.
And I was
There are
like,
more
oh my
words in there.
gosh, like, why aren't you talking to me? So that was a little bit more challenging, concerning. And I think I might've made that a bigger deal than what we needed to. Looking back, hindsight's
I know.
2020.
Yeah.
But yeah, it's so different. And so girls were easier in high school, I thought, than Ian. And now I feel like they're all I almost feel like it's more difficult. I didn't realize I was such a control freak. I mean, yeah, the kids told me I was. I've been told before by my husband I'm a control freak. And I didn't really appreciate it until after they were all 18 and I said no and it just didn't matter anymore. I was like, oh, wait a minute. I don't like that. Or you don't have control over or a say in the decisions. You kind of just have to sit back and hope for the best. So I think in ways it's gotten harder with my personality, than easier as they've gotten older.
And the stakes are higher. And so
Yes.
you worry. Like,
Yes.
I mean, this week, again, dropping her off at school, I was telling my friend, I have not slept well this week at all because I've been worried. I'm like, oh, and of course we have too much information. I'm like, she's sitting in her room. Is she sitting there by herself? Like, what's going on? Is she okay? Is she going to find her classes? And oh my God. Yeah.
It's hard.
It's
it's hard. So
being a mom, and just being a woman, being yourself, like, what are you most proud of? This is like the question that, we love to throw out, and inside at this point in your life, what do you feel most proud of?
Oh my goodness. I think I'm going to have to just bring it back to my family. I think having, we've been married for 28 years. I think that is a huge success on its own. It's not been easy. And if you were to sit and talk to him, you'd be like, oh my goodness, it's been a work. But I think having 4 good humans as children is probably what we're most proud of. Do we agree with all their decisions? Nope.
Yep.
Would we like things to maybe be different? Absolutely. But at the end of the day, they are all really good humans.
Yeah.
And so that, I think, is probably what I'm most proud of.
Yeah.
So
That's awesome.
I love it.
Well, we are so glad that you took time out of your busy day to join us today on the show. We love diving deeper into everybody's story, and it's so empowering to hear about. I mean, I feel like when anybody talks about having more than one child, I'm like in awe, and then 2, and then 3, and then 4. I'm just like, oh my gosh, and you survived it, and raised good humans. I think that's it's amazing. So we really appreciate you. We are looking forward to, seeing the success of your business. And we'll definitely, if you want to tell people how to find your website, we'd love for you to plug that in.
Yeah. Well, first of all, thank you so much for having me. I really do appreciate the time and respect what you ladies do, and the podcast. I've been listening to it. I love it. It's great. So thank you so much. And yes, you can find me at Good Integrative Healthcare. So www.goodintegrativehealthcare.com, and on the socials at Good Integrative Healthcare as well. So I'm in downtown Littleton.
Perfect.
Awesome.
Well, thank you so much for being on the show.
Thank you.